that you see very frequently in lots of different long-term conditions. And obviously, as always, I will be talking about my experiences and, stigma that you can see in sickle cell anemia. But as I say, it really is experienced in a lot of medical conditions, including mental health, for example. That's a really big one. So I thought, as a starting point, what do people know about stigma? What do people actually understand what the term stigma means? So as a starting point, I thought, let me just pull up a couple of definitions just so that we're all on the same page. I'm just going to read it from my laptop. So I did a Google search. So stigma is a mark of disgrace associated with a particular circumstance, quality, or person. So that's one definition. Then there's another definition I also put in: social stigma. Social stigma is the disapproval of or discrimination against a person based on perceivable social characteristics that serve to distinguish them from other members of society. And that's a Wikipedia definition, the rest of society. And examples of characteristics would be culture, gender, race, or health. And obviously, I'm going to be talking about health. So now that we've got those definitions, then hopefully you'll sort of get a better picture of what I'm discussing here. In terms of sickle cell, there's lots of different ways in which stigma is seen. So I'm going to take you through the points, and I've got 6 points to go through. So, numero uno, I'm going to do Italian numerics today. I don't know, I just fancy doing it for some reason. So number one, numero uno, one way in which people with sickle cell experience stigma is when you talk to someone and you explain what it is and you say it's a blood disorder. And I think the moment someone says the term blood and disorder, I think there is something in that, that other individual that suddenly thinks infectious, because there's a lot of infectious diseases that come out of, blood. I think there's that kind of there's this thing that goes on, but I just want to make it very clear, you can't catch it. And even, even if it was an infectious blood disorder, we shouldn't stigmatize that either. So we obviously know people with HIV or hepatitis have a lot of, there's a lot of stigmatization experienced by those individuals, which also it's not appropriate, and it doesn't have any positive implications in society and in those individuals. So, but in this context, again, let's take it back to sickle cell. It's a genetic blood disorder. It's not infectious. So that's a completely wrong misconception, which unfortunately a lot of sicklers experience. So number two, and this is a big one. So numero due, forgot my numerics. Hopefully you would have sort of seen in my previous vlogs that one way in which sickle cell presents itself is through the experience of a lot of pain crisis. So if you haven't seen it, please do have a look at my other videos. It might explain it a little bit more. But because of that, pain management is a massive, massive thing. We can go into a sudden pain crisis, which involves hospitalization sometimes, or sometimes managing it at home by ourselves. So opioids, which are very commonly used in lots of different types of pain management. And your opioids, if you haven't heard of them, you might have heard of things like codeine, oxycodone, and morphine is a big one. So if you've heard of all of these drugs, codeine, oxycodone, and morphine, you will know that they are incredibly addictive. So there is an opioid addiction that can come out of it. Not always, just to clarify, but it can. In some people, you can get opioid addictions. So just to out of taking it. So because of this, a lot of people with sickle cell experience, especially from the healthcare system, from doctors and nurses, they experience, I guess, stigmatization and this belief that sicklers are seeking opioids. So that sicklers will present, when I say sicklers, sorry, I mean people with sickle cell, we present to, into a healthcare setting, to the doctor or the hospital, and they will be seeking opioids. They'll be pretending that they're in pain so that they can have opioids. So that's a very, very big misconception as well. And so basically, to go into hospital and then to sort of be denied opioids, if that is something, if that is a medication that works for you, to be denied that is obviously really dangerous, and unfortunately happens a lot. And it actually happened to me. So I remember I had a painful crisis. I got admitted into hospital. As part of my pain plan, the doctor gave me those 3 different types of medication: paracetamol, an anti-inflammatory, I think it was naproxen, and morphine, which is an opioid, like I said. So these will be given as a combination of intravenously, so like injected into the veins, or in tablet form. I can understand from a healthcare professional point of view that there are risks of getting those addictions, sure. But it was what the doctor prescribed. And in fact, I really do not like taking opioids. I avoid it as much as I can, because actually I really don't like the side effects. They make me really, really drowsy and quite floaty. And they also actually make me really itchy. Morphine makes me really itchy, and I'm just there in hospital like, which I'm in pain, and I'm also like, okay, itch. So yeah, I actually don't enjoy it. So I'd rather not take it. But if I'm in that much pain and it just takes the edge off, then I'm taking it. I am taking it. And it was prescribed, and I remember you have like sort of like a dose range, I guess, and you can also take it every sort of few hours. And I asked for it the one time and I had it, and then but the nurse didn't give me the maximum dose, which was quite frustrating, because I think in pain management, really what you want to do is try and give the highest possible dose so that you manage the pain as effectively as possible, rather than keep taking it over and over. But she didn't. So she didn't give it to me, and I knew that she didn't give me the maximum dose. So I asked again if she could give me some more, and she kind of gave me this look. And I could tell she was processing it, and she was like, very skeptical. Are you sure you need it? What sort of level of pain are you in? Say it between, from 1 to 10, how much pain are you in? And I'm just like, I need it. I know I need it. I'm at whatever, 8 or 9, I don't know what it was. And then she's like, okay, I'll come back. She doesn't come back. So I asked for it again. And she was like, again, I was like, why are you not, can I please have it? She's like, you just had it a few hours ago. I was like, yeah, but you didn't give me the full dose. I know I can have more. And so she was like, okay, let me go check with the doctor. But then she never came. So again, like maybe half an hour later, so there's me like really in pain, like really struggling. Half an hour later, I'm still not having my dose of morphine that I asked for. Asking, and I was like, please can you get me the doctor, because you're not giving me this medication, So she was like, okay, fine, I'll double check it with the doctor. So the doctor finally comes and the doctor agrees it. But it was just really frustrating. She put me in unnecessary pain for an extra hour or so, or maybe even more than that, an hour and a half. And she wasted the doctor's time, who had written the prescription. And like, just he or she could have, I can't remember who it was now, he or she could have been doing something much more appropriate than coming to see me. And also I just didn't appreciate being made to feel like I was some sort of addict, which I wasn't. I'm not. And not that I'm stigmatizing addictions either, but it wasn't right. And it was very like, it was frustrating. It was really frustrating. And I also think it was quite dangerous, as I say. Inappropriate pain management leads to further complications. So that's opioid addictions. And I also know that I've spoken to plenty of other people in the sickle cell community that have unfortunately experienced a very similar thing, and being made to feel that they were requesting, their opioids inappropriately. So that's a big one. So yeah, número 3. So número 3 Another way in which you would manage sickle cell is through getting blood transfusions. And when we've got sort of new blood coming in, it really helps to manage a lot of the complications that we get from sickle cell. But unfortunately, within the Black community and ethnic minority community, blood donations is something that just isn't happening enough, and that's because it has a stigmatization of its own, for various different reasons. I think one of them is that there is a bit of a mistrust in the healthcare system, not quite understanding what their blood is going to be utilized for, how it's going to be used, who it's going to be used for, that sort of thing. And that mistrust is from years and years and years of just different things happening in the past, of which is a whole other topic of its own. So I think that's one thing. Secondly, it's sort of like a cultural thing as well. I know, for example, where I'm from originally, I think doing things like blood donations, it's just something that you just wouldn't really see. There's a lack of understanding again of what it is. There might be like some sort of superstition around it as well in some cultures, and so that will obviously prevent people from donating blood. But I just want to say that that's again it's a stigma that has massive negative implications in populations in society, and in people like myself. I went through a very serious complication 2 or 3 years ago, and to be honest, having transfusions has basically saved my life. So it does a lot. It does a lot of really positive things. So yeah, that's one stigma that has unfortunately negative implications. So if you're Black, please, please, please donate blood. Go and donate blood if you can. And anyone really, but obviously in this context again, where we need more Black donors. Okay, so número 4. The next one, is the whole stigma of laziness. This is again another big one. So I don't know if you've come across many people with sickle cell, but as I've said in a few of my in my vlogs, it can make you feel quite lethargic if your hemoglobin, so your iron, is a type of the thing that carries oxygen in your body, is really low. You're gonna be feeling quite weak. You're gonna be quite low in energy, and you could kind of like come across a bit. Sometimes you can just be a bit slower in how you carry yourself, and you're just quite tired, or you might not want to go out, and that sort of thing. And so this unfortunately can get perceived as laziness, and I've seen this very frequently with myself or with people close to me. And again, it's a negative. It's not appropriate. It doesn't make the receiving person feel any good about themselves, and it's actually just a complete misunderstanding. Because people are like, well, why don't you just eat better? Why don't you just eat more vegetables? It will give you energy. Why don't you do a little bit of exercise? That will help. And why don't you do like all these little things? You should get up and just force yourself. And of course, there's a lot of truth in all of this. And I will put my hands up and say I can be actually quite a lazy person separately to my sickle cell, but it's very frustrating when you know that the reason you're feeling weak and lethargic is because of your sickle cell, but people are not really understanding that, and they're just giving you these kind of like judgments, and these kind of they're just not really understanding why it's there, and that can feel quite degrading sometimes. It can just feel it's not nice. It's not nice to be on the receiving end of that. I've linked to that, numero 5. I don't know why I keep doing this. So numero 5. Linked to laziness is weakness, and weakness is a big one, especially in certain cultures. So for example, in Gambia, in West Africa, or what I can only speak for that. It's you especially if you're a guy, you've got to be strong. You've got this masculinity, you've got to be a certain way, or and you can't be weak, and you've got to show strength, and that's also physically and mentally. I think because of this stigma, you'd get maybe denial and a lot of family members, or you would get almost like sometimes being very slightly ostracized. I had like a friend of mine when I was younger who was from West Africa. He had sickle cell, and I remember him telling me a story about how his dad at some point just refused to believe that he had it and almost didn't want to speak to him, just didn't want to speak to him for a long time because of that, because he felt some sort of shame that his son had it. And, you know, there was this perception that because of that, his son was weak. And you know, it's just, again, it's not nice for the receiving person to be made to feel that way. So linked to this, number six. So number six is the fact that we cannot achieve things. So again, being told, when you tell someone that you've got sickle cell, they always, I don't know, there's this reaction that comes out of them. Oh my, you know, it kind of comes with pity, and there's this kind of like perception that you can't do things, right? So also things like, okay, it's true. Like I just said, we can feel weaker, we can feel more lethargic. It can really impact us in terms of pain. So we can go in and out of hospital, but it doesn't mean that we cannot achieve things. It doesn't mean that we cannot do our job properly. It doesn't mean that we cannot study and do and excel in our studies. It'll be much harder, sure, but it doesn't mean that it cannot be done. It doesn't mean that we cannot participate in sports. And I think if people have that stigma, and if people have that perception, that prejudice, it again will make the person at the receiving end, so someone with sickle cell, believe sometimes that they cannot do these things, and also like maybe it will be that they're not maybe given a job inappropriately, or that they're not put forward for things. So that's I think that's a really big one for me, because I really don't like the whole being put in a box and being put under a label, and just being made to feel that I couldn't achieve anything because of my condition. Thankfully, that hasn't happened to me much, but I think it's, again, just a very negative thing. So what are the implications of these stigma points that I've just talked about? I'm just going to read again something that I have researched, and this basically comes from the American Psychological Association. So this basically talks about stigma as well. And this is what it says: the lives of people with disease and disability are worsened by stigma, thus leading to public prejudice, loss of self-worth, and negative implications of health and well-being. So again, yeah, leading to prejudice, loss of self-worth, and negative implications of health and well-being. I think that's a really, really good description. So these are, yeah, the implications. If we go through some of the things that I said, you can imagine if you're talking to someone and you tell them that you've got sickle cell, and these are the sort of things that you get back. Of course, you're not going to want to talk about it. You're not going to want to tell people. You're going to be very secretive about it. And can you imagine the implications? You're not going to be getting the right care. So if you're in pain, you might keep it inside and suffer in silence. You are not going to be getting the right necessary support. And this can, you're going to feel really, like, as it said there, about your self-worth. So that has a lot of mental health implications as well. You will see a lot of exhaustion from trying to manage your condition on your own. You will see depression, you will see anxiety, and as you can imagine, that will have massive implications on your mental health. And other implications, like I said, is being discriminated against, so not being able to achieve things, but not because you didn't set out to achieve those things, but because society made you feel like you couldn't achieve those things. So not being able to achieve a job, or finish your studies, or whatever it is. And that obviously has a ripple effect, and that will have an effect on society and population and communities as a whole. So these are quite serious, and I think hopefully me talking about this today has sort of shown you just how important it is to talk about different conditions, and to be aware, and also to be aware of your own prejudices and responses, and how you might discriminate against somebody with a long-term condition. I've obviously been talking about sickle cell, but even say conditions like I said earlier on, HIV, or conditions like obesity, conditions like diabetes, conditions like heart problems, heart complications. You know, people will have their own prejudices against those conditions, such as, oh, like I said, laziness, they don't eat well, they don't do, and all of these things are not, they're not productive and they don't support the individual. So raising awareness is really important, and talking about conditions in a very open and honest dialogue is a really good way of tackling stigmatization as well. I think, I'm not quite sure yet what I'm going to do for the next vlog, but I think I'm going to have actually somebody come in, which I'm really excited about, to talk about another long-term condition. So not sickle cell, so which is yay, which is great. You know, the more we raise awareness, the better. So please do watch out for that. And thank you so much for tuning in and listening in. I hope you did find it useful. And please take care. Remember to wear those masks, and just to look out for yourselves and friends and family. Okay, take care.